How can we help break the stigma surrounding suicide?
So I think that having podcasts such as
So,
yours, right,
such
and
as we're
many
talking
more,
about,
it um, is vital, right?
right?
It needs to become part of commonplace conversation because on the one hand, one could say, oh, and I don't mean in any diminishment, like, oh, that person is so brave talking about their suicide attempt. Right? And
Yeah,
yes, maybe it's kind of brave and courageous to talk about it, but let's break that down. Why exactly is it brave? Right? Is it brave to
right.
talk about? I don't know. I have a heart problem, or I have a lung problem, right? I mean, maybe yes, maybe no, but I don't think the same extent as it when it comes to mental health, right?
Yeah, no, I
It-
completely agree. I actually think that's really dangerous. And I mean, even if when someone passes away, oh, they're so strong and brave and they're not crying. I'm like, what is that about? Like,
yes, yeah.
it's like, I don't like that.
Yeah. So it's really talking about the human experience, right?
Hmm.
Suicide in the United States, per most recent statistics, is the 11th leading cause of death. And you think of how many people attempted suicide, right?
Right.
This is not uncommon to have suicidal thoughts and suicidal behavior. And worldwide, according to most recent statistics, 700,000 people died by suicide.
Hmm.
So this is something that either oneself has experienced, one's family member or members have experienced, friends in the workplace, right?
Yeah.
That to hide this away is so wrong. I also want to say, in terms of risk factors, that, and also we're talking about the stigma, is that person might think this is personal weakness.
Right.
This is a character flaw, right?
Not at all. Hmm.
And that is so wrong. Okay.
Absolutely.
Nothing to do with one's character or personality. And you can also say that although it's impacting oneself as an individual, one is within concentric circles. There's
Yeah.
your birth biology, what you
Right.
were born with, right? Your
Hmm.
genetics, your physical health, the family that you were born into, right? The community that you're living in. So there's concentric circles. It has nothing to do with a character flaw. And
Right.
related to that, I just want to segue back into the risk factors because I want to mention community risk factors,
Oh,
right?
okay.
And this again is per the CDC,
Hmm.
um, some of which we've talked about: lack of access to health care, suicide clusters in the community, stress of acculturation, community violence, historical trauma, and discrimination,
Oh, yes. I was thinking about racism.
right?
Absolutely.
So all of those combining, are related to risk factors and also um, can go into stigma. So here's another example.
Sure.
A person could say, well, why didn't the person go for help? Kind of blaming them. Well, why
Right.
did you go for help? Right? One could be an example related to they don't have the money to go for help, right? The money to
Right.
pay for the service, or the lack of insurance, or as we said before, this lack of the service, the emergency room, right? Or the lack of the knowledge of calling 988,